the number one, with 3/4 saying potential future therapies that were not being previously considered for a patient, is a very powerful answer. This test is truly potentially impacting the way a patient is going to be treated and changing the way a patient is going to be treated. And that is clearly a valuable test when you can do that. Or in the second answer, gives added confidence that the approach that the clinician is taking is the right one. And why is that? Because you've gotten additional information from DefineMBC, which confirms and corroborates what you saw earlier. So sometimes things don't change. Sometimes they do, and you act on it. Sometimes they don't, and you continue to act on what you knew before. And those were very important. Also, this up-to-date point, and that was in the question, you know, the trajectory of metastatic breast cancer is a very long one. For most patients these days, thankfully, it's measured in years, and in some patients even longer, even a decade or more. And under the pressure of therapy, as well as the inherent nature of cancer to mutate and change, it's important to have up-to-date information about where that patient's cancer stands today, and not necessarily the way it was 5 years ago. So having a non-invasive test that you can sample and get information that is truly up to date was obviously felt to be valuable here. I want to just talk about the fourth one as well. A third of people felt that in newly diagnosed metastatic disease, there may have been challenges to getting a biopsy. Perhaps a patient was in poor health and couldn't tolerate an invasive biopsy of a lung lesion or a liver lesion. Perhaps a patient only had bone-only disease, which happens about 25% of the time in metastatic breast cancer. And those biopsies can be challenging to do, and they can also be challenging to interpret because bone has to be decalcified, in some cases making the protein expression testing unreliable. So it was interesting to see that a third of the respondents felt that DefineMBC could substitute in a way for a tissue biopsy if the tissue biopsy was not able to be adequately performed. So I think overall here, you're seeing multiple use cases of DefineMBC that make it an extremely valuable test with clinical utility.